Assalamu alaikum wa rahmatullahi wa barakatuh. Today we will continue the discussion of different contraceptive methods. After finishing the first part, this is the second part of this topic. So what are the other contraceptive methods other than the hormones, the intrauterine device? What are other methods? This is one of them, which is called contraceptive vaginal ring. It is a flexible ring, as you see in this photo, okay, and contains some progestogen and some estrogen. Ethinyl estradiol is still the type of estrogen, and etinogestrel is the type of progestogen present. Actually, it is easy to insert and remove. You can teach your patient for one time and then she can do it by herself at home. And the ring is left in the vagina for 3 weeks. So 3 weeks in and 1 week out. It acts by inhibition of ovulation that is achieved by a lower dose of ethinyl estradiol than the oral pills. So what is the significance of this one? Less ethinyl estradiol with its proposed side effects. Easy to use, transparent, soft. The very early methods were barrier. They are trying to put a barrier between the semen and its course, between the semen and the vagina or the cervix, so it will interrupt the normal pathway for sperms. And they may include male or female methods. For the male, it is only the condom. For females, we have condom, diaphragm, or spermicides present with other methods. And all barrier methods are client dependent. What is meant by this? This means that the woman or the man should use it. So if one forgets, it will not work. Also, they should be used effectively by the proper way. So proper time and proper way are essential for this methods, and to be effective they need to be used correctly and consistently with every act of sexual intercourse. This correct and consistent use requires motivation, skills, and open communication between partners. It is not so easy to use these barriers at the proper time between couples. Okay, yeah, it needs some sort of motivation. Sometimes the husband is not okay for the male condom, sometimes the woman is not okay for the condom, or the female is not okay with the male condom. I don't want it. Skills, because you have to use it properly. This is the barrier methods. It acts by physically, and mostly we put some chemically blocking the passage of the sperm. In some cases, they can also prevent transmission of sexually transmitted infections between partners, and this is very important. So it has a role in preventing transmission of these diseases. When a woman is using oral contraceptive pills and the husband has an infection, local infection, or infections that can be transmitted by STIs, as sexually transmitted, these pills will not prevent, but by physical and chemical of the barrier methods you can prevent this transmission. So it has another rule other than contraceptive rule. So it effectively prevents pregnancy if used consistently and correctly, and it prevents against sexually transmitted infections including HIV. It is safe, no systemic side effects as hormones, easy to initiate and discontinue whatever time you can use it, immediately return for fertility after stopping it, and the barrier method does not require a clinic visit. You can do it at home without visiting the clinic, except for what's called diaphragm. But many disadvantages. It is not as effective as other methods. Failure rate is high failure rate, and some people find them difficult to use, and some methods require partners' participation, and also the coitus related and may interrupt sexual, they are coitus related and may interrupt sexual activity. Okay, so it has some psychological or emotional limits to use. Need proper storage and need resupply all the time. It may not be available at the time of sexual activity, so it needs resupply. You can read these rapidly. That the male latex condom effective when used in a proper way, and failure rate is 3%, but in the actual world failure rate is 14%. So high. What is the difference between them? This means standardized use in a proper way and time. Here, no, it is the use in the community and very high failure rate. It is available, protect against HIV as we said, and it needs this point, very important, male partner cooperation, and this is not present in most of couples and can be damaged by exposure to oil-based lubricants, heat, humidity or light, so don't add something for it. The female condom it has an internal ring inserted deeply in the vagina with external wide ring that protects the vulva and the perineal skin. Effective when used also properly, but less effective as commonly used in a client typical use. The same principle as a male condom, and protects also from bacteria and other viral sexually transmitted infections. The diaphragm fits inside the vagina obliquely, more effective when used with spermicides. All these barrier methods, you should use something to support spermicides chemical. First time must be fitted by a trained provider, and it is reusable and can be inserted up to 6 hours before the intercourse. It shouldn't be removed earlier than 6 hours after the intercourse. No douching after intercourse or before removal, because this douching may carry some sperms inside, so it increases its failure. It may cause irritation, you can expect that, because foreign body is present inside the vagina. Also urinary tract infection. Any foreign body here will invite infection for the urinary tract. It may decrease the risk of some bacterial sexually transmitted infections, especially when used with spermicides, but you can expect that it will be less effective in this if without spermicides and in comparison with the condoms, either male or female condoms. Okay, the spermicide material, the active ingredient is in most of cases is nonoxynol 9 in foaming tablets or foam or cream. Okay, and it is much less effective than other modern methods. It acts by inactivating the sperm and provide modest protection against bacterial sexually transmitted infections. Again, it can increase the urinary tract infection in women, so better to be used with other methods. This is how the vaginal diaphragm is introduced, and it is put obliquely inside around the cervix, and this is how one of the methods of the spermicides in the form of cream applied inside the vagina before intercourse, and you have to remember that it is not as effective as other methods. So in most of cases, if you are using some of them, you have to use dual methods. Condoms are used as a primary method for protection of sexually transmitted infections and secondly pregnancy. in emergency contraception can be used as a backup method if a condom breaks or slips. We speak about the spermicides. Okay, we speak about spermicides. We add it for the condoms. We add it as a backup with emergency contraception if the condom, as we said, breaks or slips, or not used in a particular for particular act of intercourse. Also, emergency contraception, however, will not protect against sexually transmitted infections. Okay, remember that. An alternative approach is to use a highly effective method as a primary means for pregnancy prevention and still use a male or female condom for sexually transmitted infection prevention. Sexually transmitted infections prevention. Okay, so better to use it with other methods. Okay, another very important topic is lactational amenorrhea method. As you know from your knowledge that during lactation the ovulation will not occur after except after some weeks or months, differs from one patient to another, and during lactation this method may be used as a contraceptive effective method when applied by these criteria. You have to realize that it is a temporary contraception method in the postpartum. It will be as high as 98% effectiveness if within 6 months postpartum, associated with complete amenorrhea, no menstruation, fully or nearly fully breastfeeding during this period. For continued protection, another method of contraception should be used. How it will act? Stimulation of the nipples will stimulate nerve impulses to the hypothalamus, release prolactin, which will disrupt the gonadotropin releasing hormone FSH and LH, and so no ovulation will occur. So this is the act of nipple stimulation. Many advances are actually available, effective when criteria are present, protect against protection begins immediately, health benefits of breastfeeding for the mother and infant, no supplies are required, and can be used temporarily while a breastfeeding woman decides about other methods. But some disadvantages that full or nearly full breastfeeding should be present. No protection from sexually transmitted infections. Limited duration for the first 6 months and only used by breastfeeding women. So it is limited to a certain period in women's life. And this is how to use lactational amenorrhea method algorithm for depending on it as a method of contraception. So, has your menses returned? Yes, immediately go to another method. No. Are you supplying something else during breastfeeding? Yes, go to another method. If no, is your baby more than 6 months? Yes, go another method. If no, no additional contraception necessary. So this is how you will ask your patient very simple questions in order to say, yeah, you can depend on lactational amenorrhea as a method of contraception, or no, you have to go to another method of contraception. Another important, if you have a patient lactating and came to you asking, doctor, I need a method for contraception, you should answer some questions for yourself and for the mother. Is it safe for the lactation? This method will suppress lactation? Is it harmful for the baby or not? Does it carry a high risk for thrombosis, venous thrombosis, which is common in the postpartum period? So you have to think about, and the impact on lactation, breastfeeding, and infant health should be considered. So immediately postpartum, immediately safe to use intrauterine device or barrier methods, or do female sterilization when it is indicated for medical causes or other causes during postpartum period. So after 6 weeks postpartum, you can use progestogen only methods as POPs or injectables or subdermal implants or hormonal intrauterine system. Later on, methods containing estrogen may be used as combined pills or combined injectables. On another way, if you're speaking about breastfeeding women, the first choice will be barriers, IUDs, sterilization, or natural family planning. Second choice will be hormones, POPs with progestogens with its different modalities. The third choice will be the combined hormones, either injectables or combined pills. Okay. What are the other non-hormonal methods? Other non-hormonal methods. We spoke about barrier methods. We spoke about lactational amenorrhea. You can use this traditional methods as periodic abstinence from during the fertile time of the woman. How to identify this period, either by calendar or red method, or using basal body temperature, or taking a cervical mucus examination, or by what's called symptothermal method. And all of these are indicators of what? Of what? Yeah, of ovulation. Yeah, you do know how to diagnose ovulation by these different methods. Advanced as it is user controlled, available, safe, free from side effects, but again it requires skills, signs of fertility not reliable to be sure for ovulation time. It requires partners' cooperation to abstain. There is no protection against sexually transmitted infections. High failure rate. It has a relatively high failure rate. Coitus interruptus, you will remove the before ejaculation. Failure rate very high, up to 19%. It is correct and consistent use requires self-control, and this is difficult. It provides no protection against infections. Also, pelvic congestion for both partners is a very common side effect, and is bad for this method. But some couples use it. Yeah, they use it. Okay, another important topic is emergency contraception. What is meant by emergency contraception? If there is unprotected intercourse without planned use of contraception before, and we need to use a contraception that will be effective in this emergency situation, like what? No method used before as rape, or method didn't function properly, condom tear, or method used incorrectly, missed pills, or failure to withdraw, something like that. So there is a failure to use the routine or the regular or planned contraception, and we need to interfere. What are the options? Either hormones or the IUD. The hormones, special hormonal pills are present and should be initiated not later than 72 hours. The progestin is more effective in this situation than combined pills, and this is the reverse to what we know about the efficiency. We know that combined pills are more effective when used in a regular pattern for 21 days, but here in emergency contraception, the progestin only pills are more effective. We can use also copper IUD if within 5 days. So hormones within 3 days, copper IUD within 5 days. What are the possible mechanisms to inhibit or delay ovulation? These are the hormones or have other contraceptive effects after ovulation. It prevents implantation of the fertilized zygote, etc. The regimen for progestin only pills, the first dose is 0.75 milligram levonorgestrel, and as we said, within 3 days, and then repeat the same dose 12 hours after the first dose. Okay, So if you have one pill per dose, it will contain 0.75. If you have this dose 0.0375, so you have to take 20 pills per dose. Okay, if your pill has 0.3, you have to have 25 pills per dose. Why this? Because this is the regular dose of levonorgestrel in the contraceptive pills, but here we have a special form for this pills containing 0.75, so one pill will be efficient or sufficient. The combined regimen is called GOSP regimen, and each dose, first and repeat, should contain at least 0.1 milligram of ethinyl estradiol and 0.5 milligram of levonorgestrel, which equals 4 tablets of the standard low dose combined pills. So you can advise your patient to take 4 tablets, and after 12 hours she will take another 4 tablets of low dose combined pills. Effectiveness of progestin only 85% up to 89%. Combined pills about 60 to 75, and the copper IUD is highly effective, and pregnancy rate is 0.1%. So it is the most effective non-hormonal. The hormones, regarding the hormones, the most effective will be progestin only pills. We have some side effects for the hormones, like some nausea and vomiting. It is most common, but less commonly your patient will suffer from headache, dizziness, fatigue, breast tenderness, irregular bleeding and spotting, and these are the common side effects of POP and COX. More common with COX, these side effects will occur because of, yes, estrogen component present in these pills. If you use the device, intrauterine device, you can expect some cramping and heavy menstrual bleeding and spotting, and again these are not specific for this emergency situation, but to any use of intrauterine device, either as emergency or as non-emergent situation. Come to another method. If you want to sterilize your patient, permanent infertility, either the female or male. For the female, you should use it only when medically indicated, because we have ethical and religious restrictions for this operation. The operation is tubal occlusion. It is safe, effective, highly effective, but still we have a failure rate, remember that. And this is a permanent with maybe a long-term adverse effects, we don't know. But the disadvantage is surgical complications. There's an operation, you can injure organs, and you can expose your patient for infection. Later on, a patient is exposed to bleeding during surgery or later after surgery, primary or secondary hemorrhage. There is no protection against sexually transmitted infection. So advise your patient, if you are drawing female sterilization, yes, you may be infertile, you may not get pregnant, but you are not protected against infections. Use local methods, and it is not reversible. It has a cost. When to do? Maybe within the first 7 days postpartum, when you are doing cesarean section, or any time after 4 weeks after delivery. Does it have a long-term health effects? Maybe yes, maybe no. Doesn't cause women to experience menstrual irregularities, but some women will complain of painful menses, heavy bleeding, changes in the cycle length. It has no effect on sexuality, and it protects against ovarian cancer, maybe because they found that the origin of epithelial ovarian cancers is the tubal cells. It protects from PID, yes, because it will close the way of the tubes to reach the ovaries and the peritoneum. We have many techniques to do it, either cut the tubes, or cut and ligate, or make a hole in the peritoneum and both ends inside, or cut the fembria, fembryectomy, We have many different methods. All of them is dependent on disruption of the tube. May be done by laparoscopy or laparotomy during cesarean section, may be done by hysteroscopy or posterior colpotomy. So laparoscopy, laparotomy during cesarean section, hysteroscopy or posterior colpotomy. Different methods by laparoscopy. You can cauterize, apply a ring, Fallop ring, or a clip, whole clips. During laparotomy, just don't bother your brain about the names. So you will interrupt either by cutting the tube or cutting the fimbrium. Okay. This is a method where we catch the tube. This is the uterus. The fallopian tube was cauterized in more than one side. Is it a possibility to sterilize male? Yeah. Why all things towards female? We should also think about male. So we will do what's called vasectomy, but it is not offered in Egypt and Islamic countries. It is simpler than female sterilization. You will tie or cut the vas deferens. Again, it is a permanent method, and you have to wait for about 12 weeks or 20 ejaculates in order to be effective. Why? Because we have a reservoir. Yeah. This is your rule as a GP to checklist rule out pregnancy when you have a patient coming to you and you have to rule out before doing interferences or radiology or surgery, etc. You have to rule out it. So if pregnancy test is not available in non-menstruating client and you need to exclude pregnancy, and when using this checklist, it is 99% effective. Okay, so if you don't have a pregnancy test, use this checklist in order to exclude pregnancy. Ask the client 6 questions. If yes to any of one question and no signs or symptoms of pregnancy, then safely provide the method. And pregnancy can't be always ruled out. In these cases, the woman may go for a pregnancy test. So don't hesitate to do pregnancy test when you are in doubt. What are these questions? Are you less than 6 months postpartum and fully breastfeeding and free of menstrual bleeding? Do you remember this one? Yeah, it is the criteria for effective lactational amenorrhea as a method of contraception. Okay. Have you abstained from sexual intercourse since your last menses? If yes, go. Have you given birth in the last 4 weeks? If yes, go, because it is not expected to ovulate before 4 weeks. Did your last menstrual period start within the past 7 days? Okay, because why this is safe? Because we are away again from the ovulation. It will not occur before 7 days. Have you had a miscarriage or abortion in the past 7 days? And here, miscarriage is like menses. It is not like delivery. Yeah, excellent. So if it is delivery, you will ask for about 4 weeks. If it is miscarriage, only 1 week, because again, ovulation can occur immediately in the same cycle following this abortion, so it is considered as menstrual flow. Have you been using a reliable contraceptive method consistently and correctly? So these are the checklist. If you don't have the contraceptive for pregnancy kits to do pregnancy testing, and you are in need to confirm or to exclude presence of a pregnancy in order to proceed to your interference for the patient, ask these questions, and this is your rule as a GB or a specialist later on. These are the questions in another form, and you can take a look for these future methods, either barrier methods. Actually, these are not a future, they are a recent, not a future one. And for the hormones, already we have the different methods already available of these hormonal local skin preparations, and for the male still they are trying to provide a pill for the male to form azoospermia, and some of these researches are already finished. Okay, I think that's all for the second part of contraception. I hope that you are understanding well. Study hard and see you later on, inshallah. Assalamu alaikum wa rahmatullahi wa barakatuh.